Hey guys, this is Dr. Jean-Guy. Today I'd like to talk to you about scoliosis. So some of you might have heard the word scoliosis before, but you're not sure what that means. Actually, there's a lot of people, there's misconception about scoliosis, what that means and really what that is. But here we have an expertise in scoliosis, and what that means is we do address that. And obviously this can happen, some that may be unbeknown to you. But scoliosis can happen at any time. It can happen as soon as you're born. It can happen as a teenager. It can also happen when a person is becoming older, 50, 60, 70 years old. And the definition of a scoliosis is, if you look at my spine here, right? The spine from the front should look like a cucumber, if you've heard that from me before. And when you start having deviation from side to side from the front, that would be considered a scoliosis. And again, this can happen at any given time, and anybody can have it. Now, it is very common. It's more common in adolescent, meaning that as a teenager, 10, 11, 12, 13 years old, that's usually where the pediatrician is going to start looking at it, or even the parents. And then those things are going to be addressed. In the medical way of thinking or doing things, oftentimes we're just going to watch it until the next time, and we're going to see the progression. We kind of have a different approach here. For me, being a spine expert and as a chiropractor, I like to think that we would like to be proactive. And if there's any kind of issues from your spine going from side to side, it doesn't matter who you are and how old you are, we would want to address that. And there's one way that when it's needed, if you truly have a scoliosis, and there's some parameters that you have to go by, right? Sometimes there's people, they drive from hours away and they think they have a scoliosis, and really they don't. And that's okay, right? People, sometimes they need to be educated to make sure that what it is and what it's not. But if a person truly have a scoliosis at times, one of the strategy is a brace. And here's a brace here from ScoliCare. And this bracing system, right? It's called a ScoliBrace. It's a very specific brace that the way that it will brace you, that those braces are designed, they're mechanically engineered in 3 dimensions. So what I do like is I've been a chiropractor for 20 plus years. And initially when I first started my career, it was very difficult to build a brace or to have a brace that was very specific for the patient. Most of the brace out there still to this day, even from a medical point of view, is we'll squeeze the patient's spine. It's going to make it look better on the x-rays, but it's not really designed for correction. So what the ScoliBrace does that no other braces are doing is it will mirror image the spine. So for instance, if a person is like this, now the brace will bring you in the total opposite, right? It will do the opposite. And the design is not just to squeeze the spine, but in 3 dimensions, right, is to reshape it to be able to improve the structure. So that is something that the ScoliBrace can do that no other braces can do. And for me, it's really exciting because with the technology now that you can scan a person in 3 dimensions, which we do, and taking an x-rays of the person, which we do. And once we have all of that, if a person really needs to have a brace, the brace is being designed in 3D. It's mechanically engineered in 3D. And it's specifically designed for the person to mirror image their posture. So if a person is shifted over on one side, the brace is going to bring the person on the other side, right? So that's what the ScoliBrace does, which there's no other brace on the market that does that. So not only the ScoliBrace can prevent the progression, but it also has the ability to reduce at times some of those curvature, which I think that it's really exciting. So there's different application for the brace these days. We can use it for scoliosis. We can use it for what we call the hyperkyphosis, meaning if a person is like this, we can use it for that as well. We can use it in older folks when they're 50, 60, 70 years old. One of the bigger segment of the population of people that are developing a scoliosis now is in the elderly population. So again, many of you might not know that. And I just want to let you know today that we have a solution for you. If you've never heard of, or if you hear of people that have scoliosis, send them over to our office. We'll be more than happy to do the evaluation and to see if they are a fit for this particular brace or other kind of rehabilitation program that they might need to have in order to have a spine that is more towards normal, right? In order to be able for you to be the best that you can be mechanically and neurologically. So hopefully this was helpful to you, and that you know more about scoliosis than when we first started. Take care.